family planning, which some people call contraception. So this is another important aspect in safe motherhood, okay, where people must have kids or children in the numbers that they want, and also at the time that they want to have these children. And that is what we call family planning. It is simply planning to have children in the numbers that you want as a couple or as an individual, and also at the very time when you want to have these children. That is what we call family planning. And it is an important aspect in safe motherhood, like I said, because it is not healthy to have children too frequently. That is where you're not giving time of 2 years in between your birth. We usually prefer every woman to have a child or a birth at least 2 years after another child. So if you're not using contraception or family planning, it may be difficult for you to have that timing. Number two, we usually prefer not to have very many children, because that has a health impact to the mother and also financial impact to the family. So we want a couple or a family to have children that they can afford to look after and that they really wish to have. And it is only through modern methods of family planning that you can achieve this. And the contraception is used by any person who is sexually active. Some people think it has to be someone who is married. No, as long as someone in reproductive age, that is between 15 and 49 years, these are people who can potentially conceive. Therefore, if they are not ready to really have this conception, they need to have a contraceptive method, even if they are not officially married or in a stable relationship. So there are very many methods that we use for family planning, and we classify them into very many categories. We have those we call hormonal or non-hormonal methods. We shall elaborate about these as we go on. So we have several types or methods of family planning. We have those which we call modern methods. Then we have the natural methods. Then we have the temporary methods. We also have the permanent methods. We have the short term and then long term. Then we have hormonal and non-hormonal. So going forward, we are going to elaborate on each of these methods, starting with the natural methods, which are now not popular because they have a high failure rate. Okay, a failure rate is where you use a method and still you go on and conceive. It means the method has failed. So we usually want a failure rate of not more than 1%. If a method has a failure rate of more than 1%, then we don't encourage it. Unfortunately, most of the natural methods have a high failure rate. What are these natural methods? We have withdrawal. Withdrawal method is where a couple can have sexual intercourse, and at the time of orgasm, the man withdraws and ejaculates outside the vaginal cavity. That is called withdrawal method. It has very many shortfalls. Some people withdraw when sperms have already been deposited, or some people are unable to withdraw altogether. So it is a method that has a high failure rate, and we don't encourage it so much. We have another method called rhythm method. This is where we have periodic abstinence. So for couples who are able to follow their cycle, we usually teach them about the fertile days and then the safe days. Okay, when a woman sees her periods, let's say today, the first 10 days are usually safe. Then the following 7 days are usually fertile days because that's when she's ovulating. And then after those 7 days, she's safe again until her next period. So some people can choose to abstain during that fertile time of ovulation, and then they have sexual intercourse in other periods. That is rhythm method. So we can achieve this through using a calendar. That's why you sometimes call them calendar methods. We have some things to guide, like beads. There are those things you'll hear called moon beads. All these are meant to tell a woman that in this time you're fertile, in this time you're not, and therefore she can do periodic abstinence during the fertile days. Then we have barrier methods. Barrier methods is where a man or a woman puts on a barrier, okay, or a physical object that will not allow sperms to cross from the man to the woman. Examples of these barriers include condoms, which are very popular and very common. Even women have got what we call female condoms. We also have caps called cervical caps, which can be put in the vagina and cover the cap. There are so many barrier methods that we use, but the commonest that people use is a condom. When a condom is used very well and regularly, then the success rate is high. Okay, now we have the other methods which we call modern methods, and in these methods we have many categories. We have hormonal methods and non-hormonal methods. The non-hormonal methods are not very many. The commonest that we have is an IUD, what we call intrauterine device. Okay, we have a copper device, which is an intrauterine device that we place in the uterus, and this barrier or the copper does not allow conception to take place. There is another type of intrauterine device called Mirena, which has a hormone in it, progesterone. Okay, we also put it in the uterus, and its action stops only inside the uterus. We don't have any effects outside the uterus. Now we have the hormonal methods, where we have pills. Okay, most women have used pills for some time. What is special with these pills is that they have to be swallowed every day. Okay, and if a woman forgets 1 or 2 or 3 days, then the effectiveness is reduced. We have those which are combined. We call them combined oral contraceptives, the commonest being microgynon. Then we have progesterone only pills. These ones we tend to use them in early period after birth, okay, before 6 months after giving birth. They are usually not very effective after 6 months of giving birth. And we also have injections. The commonest injection is a Depo-Provera, okay, what is also called injector plan. This is an injection that we give every 3 months, okay, until when someone wants to conceive. Just like pills, someone takes pills until a time when they don't want when they want to conceive, and they stop. Then we have what we call implants. Implants, these are methods that we put under the skin. And the part of the body we commonly use is the arm. We usually use a non-dominant arm. If someone is right-handed, then we tend to use their left arm. If they are left-handed, we put them under their right arm. And it is something small like a rod, like a stick. We just push it under the skin. And we have a number of them. We have Implanon. This Implanon can stay up to 3 years. Okay. We also have a 5-year one called Jadel. These are all hormonal. They contain progesterone. And how do they work? They work by stopping a woman from ovulating, okay, so that she can't conceive, because we know if you don't ovulate, you don't conceive. We also know that these methods change some of the properties in the genital tract. For instance, there is a mucus plug that usually covers the cervix. The cervix is the entry into the uterus. So when this mucus plug is thick, it means sperms cannot pass. So most of these methods actually make that mucus plug very thick, and in so doing, they prevent sperms from entering the uterus and therefore prevent conception. Then we have what we call lactational amenorrhea. We know women after giving birth, the first 6 months, usually they don't see their periods. And in that period, actually, they are not ovulating. And that's what we call lactational amenorrhea. And that can be used as a method of contraception. When a woman breastfeeds many times, then they are more likely not to ovulate, and then this kind of method becomes more effective. But if it is a woman who is not going to breastfeed frequently, then they can't rely on this. Again, this method is only reliable up to 6 months after giving birth. After that, every woman must be enrolled on a modern family planning method. Now, we have other methods that we call permanent. So these are reserved for couples or individuals who don't want to conceive again in the future. For men, the commonest permanent method is vasectomy. This is where we identify and tie the tube that moves sperms from the testicles into the urethra. So we usually do that procedure for any man who doesn't want to conceive again or achieve a pregnancy again. Now for women, we also identify their tubes. We call them fallopian tubes. It's a small surgical procedure through a mini laparotomy where we identify these tubes and tie them. And this is meant to be permanent. However, we continually see women later on who change their mind and they want to conceive again. For such people, they can still achieve a pregnancy, but through advanced fertility technologies, the ones we call IVF. Otherwise, it won't be possible to conceive naturally. Then I already told you about the short-term and long-term methods. The short-term methods are the ones you use for a very short time. For instance, the pills that everyone swallows every day, or the injections that you take every 3 months. However, for methods that go beyond 1 year, like the Implanon, Jadel, IUD, we call those long-term methods. Okay? Depending on when someone wants to conceive again, someone may choose to be on a temporary or a short-term method. Someone may choose a long-term method. Now, the next question usually that we are asked as doctors is about the side effects or complications that are associated with these methods of family planning. These complications are not many. They are very few. And another thing is that they are manageable. And we usually ensure that individuals use appropriate methods of contraception so that they don't face most of the complications. And that's why we encourage individuals to always first go through a consultation with a doctor or a nurse so that they identify the most appropriate method of family planning. And once they do that, then many times they don't face a lot of complications. The most common side effect that we see is irregular bleeding. And this is common with most of the hormonal methods and also the intrauterine devices. This can come as a heavy menstrual bleeding, or it can come as an intermenstrual flow, or someone can keep on spotting all the time. With IUDs or intrauterine devices, some women report cramping during their periods. That is excessive pain during periods, even excessive flow. Whenever a woman is using a method of family planning and they face these side effects, they are supposed to come back to their doctor or their nurse, and these side effects are treatable. In case they continually have these effects despite treatment, then we can change them from one method of family planning to another. Failing on one method does not mean that you cannot use other methods. Okay? There are methods that can work better for an individual. There are methods that may not work. So that is something that every woman or every individual must know. Other side effects include weight gain, especially those who are using hormonal methods. They put on some bit of weight. Others get a skin rash that we call acne. Others develop a headache, especially those who have always had a history of headache in their life. So all these are side effects that we know that are manageable. Okay, of course, the biggest side effect we don't want to have is failure of this method, where someone conceives despite using a contraceptive method. And this can also be avoided by regular checkups. Whenever a woman is enrolled on a method of family planning, a doctor will give them a schedule of follow-ups Usually we want to see them after 1 month, after 3 months, then after that every 3 months. And each time you come back, your doctor will evaluate how well you're doing with this method. With intrauterine devices, we usually do scans to confirm that this IUD is in its best position. And in case the individual reports any of these side effects, they can be treated. Another question that usually comes along concerning family planning is when to start contraception after giving birth. Okay? These days we have methods that can be started immediately after giving birth. Okay? Where we give an intrauterine device or we give an implant immediately after giving birth. Apart from those methods, most of the women are required to start contraception 2 months after giving birth. Why do we say 2 months? It's because by that time we expect their bodies to have recovered from the effects of pregnancy and their eggs are already growing actively and they can actually conceive. However, for those who are breastfeeding very effectively, at least 15 times a day, they may delay to ovulate up to 6 months. That's where the aspect of lactational amenorrhea comes in. So by the time we reach 6 months, all women who have given birth must have been enrolled onto a family planning method. There are many advantages of using family planning or using a contraceptive. One, it allows a woman to space her children so that she's able to conceive again when the first child is big. And we usually want at least 2 years. And without contraception, that may be difficult to achieve. Number two, it allows that very child to breastfeed long enough. We usually encourage breastfeeding for a minimum of 1 year. Okay? Something that may not be possible if a woman conceives so fast. Number three, it allows the woman to recover from the effects of the previous pregnancy to the next pregnancy. For women who conceive very frequently, that is intervals of less than 2 years, they tend to have many health effects. Okay? They have anemia, they have malnutrition, they have chronic back pain because they don't recover from the effects of the pregnancy to the next. So all these are advantages that are enjoyed when someone uses a contraceptive method. Number three, it gives psychological comfort. Okay, when a couple is not on contraceptive and yet not willing to conceive, they keep under tension. They keep thinking they have conceived. But with the contraceptive method, they will be comfortable, they will have psychological comfort, and they know they are not going to conceive until when they want. And in terms of socio-economic aspects, contraceptives or contraception or family planning allows families to plan for their children very well. They know we want to achieve this number of children, we give them good education, we give them quality life. Okay, and only this can be achieved if contraception is used. So as we've seen, there are very many advantages of using contraceptives, and we encourage every sexually active individual who is not intending to have a child to be enrolled on a contraceptive method. There are very many myths or misconceptions that the community, the individuals have about these methods, but we want to assure you that most of these methods are safe. Some people think they cause cancer, some think they cause fibroids and swellings. I want to assure you that none of these methods is associated with any of those misconceptions that are known. This brings us to the end of this discussion. I thank you for listening in and keep tuning in to 8TV every Thursday at 5 p.m. Thanks so much. Be blessed.